Okay. All right. Good afternoon, everyone. Welcome to the Techie Surgeon podcast and video. It's Dr. Christian Payon. I am the speaker today on the Techie Surgeon and CEO and co-founder of Revel AI Health. I feel extremely fortunate to welcome to the show today Dr. Amit Phull from Doximity. Dr. Amit Phull is Chief Clinical Experience Officer at Doximity, adjunct faculty at Northwestern Medicine, and clinical assistant professor at GW. He's a board certified EM physician. He's been with Doximity for years. And here we're always talking about how quickly clinical AI and health policy are moving. I'm extremely excited to welcome you to the show and to get into it and hear how Doximity is building the clinical AI of today and tomorrow. So welcome.
Christian, wonderful to meet you, and thank you for having me. I'm super excited for the conversation.
Excellent. So just to kick it off, tell us a little bit about you. How did you get to where you are now? A lot of the folks who watch and read Techie Surgeon are themselves clinicians, founders. How did you end up at Doximity as the Chief Clinical Experience Officer?
Oh man, the way that I usually describe it to folks, I do a lot of kind of career advisory stuff now, both at Northwestern and a little bit at GW as well. Is equal parts kind of luck, serendipity, and it was just a meandering path. I guess would be the best way to describe it. A million years ago, it feels like now. I have a technical background. I was actually educated and worked a bit as a computer engineer. I knew that I was going to go to medical school and was interested in the healthcare end of things and was kind of searching without knowing that I was searching for some kind of opportunity that provided the union of those two worlds. I'm old enough to admit that when I was going through my training, there were not too many opportunities like that available. I think the world Thankfully, I'm very happy to see the fact that the world now is a good bit different for folks who are coming up in their training.
Yeah.
But I was lucky enough to have some really solid mentors that exposed me to projects early on in my career where what I would say from the engineering end of the spectrum were fairly simple projects or deliverables had profound impact on the healthcare side. And I got exposed early on to being onto something there, I guess would be the best way to describe it. I then basically raised my hand to volunteer for every opportunity that presented itself until
Love it.
one of them stuck, right? Like back in the day when I was in residency, Doximity at that time had just been founded as a company and somehow got exposed to the fact that they were looking for folks to join what they called at the time a physician advisory panel. And those are just technically minded clinical folks who were willing to beta test their software. So I raised my hand, volunteered by virtue of participating in that, got invited to what I've now since come to find and embrace as kind of the Super Bowl of the Doximity year, which is the medical advisory board.
Mm.
And at the medical advisory board that I got invited to back in 2014, came to find out that Doximity was looking for folks who had either clinical or strategy backgrounds that also could, I guess, speak tech for lack of a better phrase. So it was one of those serendipitous things, right? I was having a conversation with Jeff, who's our founder CEO, that ended as, "Hey, if you know anybody that might be interested in this kind of opportunity," and I was just standing there being like, what about me,
I
right?
love
Like I
it.
would genuinely be interested in this opportunity. So I actually joined in late 2014, and by virtue of the company growing a good bit, since then, as you might imagine, I have been able to luckily touch a whole bunch of teams along the way and have kind of like made my way to my current role where I oversee a lot of the digestion, if you will, of user feedback and make sure that we can leverage that user feedback and lay it right back into our product roadmap in terms of building into the pain points that clinicians have in the practice of medicine.
Phenomenal. That's awesome. And I'm excited to hear more about the roadmap. I think whatever you can tease out
Sure.
to us is going to be great. But before I get into that, tell us a little bit about just a day in the life of, right? You manage to still balance some of your clinical practice. I try to as well. What's your day look like? What does a week look like for you and your role?
Oh man, I think the honest answer to that is that it genuinely depends on the day or the week. Emergency medicine, my specialty. specialty permits a good amount of flexibility. So I leverage that a good deal for quite some time, even after having kind of traveled away or living not in Chicago. I would still fly back to Northwestern and practice there, basically since graduating residency up until actually just the recent past. So that flexibility is something I've been able to take a good bit of advantage of. At Doximity, it also kind of depends, to be totally honest. We have a large team that focuses on developing and maintaining multiple features and products for our user base. So it's equal parts kind of managing things that come up in regards to feedback across any of those products or features, and also digging in with particularly the R&D side of the organization and thinking through what it is that we might be doing next. So on any given week, as you might imagine, that can manifest as being primarily internally focused and talking through kind of like strategic discussions about objectives for the next year, 2 years, 3 years, or externally focused. We often take our show on the road and attend clinician conferences, try and advertise to our users new features that they might find useful in their practice. And I even get involved in a good bit of support of some of the businesses at Doximity as well, in terms of just explaining the value proposition to our clients and partners and how what we've built for clinicians and the trust that we've built with our membership permits healthy businesses to exist on that platform as well.
Fantastic. That's great. Yeah, I think that there are a lot of amazing features to Doximity and Doximity GPT. Pre-AI, I really thought of Doximity as this sort of news feed, this really fantastic resource for physicians to come together, see what the latest news was, to network with one another. And obviously, now the company is in a very different place and for the better. I think many would argue you all have now really made inroads first on the administrative burden that clinicians are facing, but increasingly you're embedded in the workflow. Not all of the readers and the listeners know about Docs GPT or Doximity GPT. Tell us
Mhm.
about the inception of the tool, what makes it different from the other tools that are out there, and how you envision clinicians using it today versus tomorrow.
Yeah, that's a great question. So I will say part of my job most recently, just to go back to your last question about what a day looks like, is banging the drum, to be honest, right?
Mhm.
We want to raise awareness because there are many of our users that probably find themselves in a similar boat to what you just described for yourself, which is,
Yeah.
oh, I remember Doximity because of X, Y, and Z, whether it be the news feed. Some folks use our scheduling solution, some folks
Hmm.
use our fax, some folks use Doximity Dialer, etc. With something like DocsGPT being net new to that product offering, we're not in a position for what it's worth being an older company, I guess,
Uh-huh.
and a public company to make a lot of noise about being an AI company. We kind of have to make our users re-engage at some
Hmm.
level with this new capability that we're particularly excited about. So to answer your specific question about the inception of DocsGPT, it feels like it was 100 years ago, but we all kind of have to remember the end of 2022, which was kind of like pre-OpenAI even coming
Yeah.
into the scene with ChatGPT, where AI was kind of whispered about, I think, in healthcare hallways, if you will, but it
A
was
lot of
mainly
machine learning, right? Risk prediction algorithms. Yeah, we read the
absolutely.
papers, but like they weren't in our workflow. Yeah,
Exactly.
yeah,
And frankly, if there was conversation around it, a lot of it, certainly from the clinician perspective, was kind of like a fear mongering, to be honest.
totally.
Like my cousin is a radiologist and he's been worried about AI coming for him for years. Um, we found that with the explosion onto the scene and just kind of into the general public consciousness of a tool like ChatGPT, we again, as a very large network of clinicians, found ourselves in the position of like, okay, how can we take this technological advancement and make it healthcare focused, healthcare specific, translatable to this large platform of clinicians and safe and secure, to be totally honest.
Yeah,
So our initial approach, was the approach that we often employ at Doximity, which is asking clinicians based on what they were exposed to in regards to AI, where they thought the most significant improvement in their clinical lives would be in terms of how we might point this kind of technology. And the early signal that we got was significantly skewed, I would say, in the direction of most time savings coming from helping with the administrative burden that exists today in terms of being a clinician. So we surveyed several hundred clinicians at the beginning of 2023. And the feedback we got then was well-designed AI tools might save anywhere on the order of 12 to 13 hours a week,
Mm,
which, as you know, as an
yeah,
orthopedic surgeon, is a ridiculous
a
amount of
ridiculous
time to
amount of time.
save a clinician. You could probably do a full-on additional operation or two. I
Oh,
could
10,
see,
10 more.
yeah, 20, 30 more patients. So when we dug into that data, we saw that the lion's share, like 90% of time savings, were actually coming from documentation support, administrative support. How can I get my notes written for me? How can I get my prior auth submitted in a way that's more likely to be approved? The unsexy part of AI would be the
Yeah,
best way to describe it. So, in listening to that feedback, we leaned in. When we released DocsGPT, which was the first kind of like AI tool released at scale, we think that it was HIPAA compliant and kind of brought with it all the bells and whistles of the Doximity platform. We actually primarily focused it on being this kind of administrative assistant. Back then, there was some data that had come out from the US Surgeon General's office that showed your average clinician for every hour of clinical work was doing 2 hours of other stuff. Some folks kind of charitably refer to it as pajama time, right? Like
yeah,
you take your work home, everyone's finishing their notes on their off days, et cetera, et cetera. So we leaned into releasing a scribe that we kept in a beta for a good bit of time to try and just work out the kinks of being specialty specific, and then having a general purpose administrative assistant tool that could help with those things like prior auths and appeals to denials, et cetera, et cetera. That worked actually quite well. We saw a good uptake in terms of people really gravitating towards DocsGPT being this assistant, but primarily a workflow assistant.
yeah,
Dug into the data in the ensuing months, we saw that despite being fashioned as an administrative assistant, a non-trivial percentage of the inbound queries to the tool were actually more kind of like clinical reference questions and kind of
yeah.
clinical decision support questions. So we thought about this for some time and re-engaged our users as to whether or not building into that signal would make sense for us. And actually, again, AI time's a little bit different than I guess normal time, but our medical advisory board for this year, 2025, was actually back in March. And we floated the idea both of leaning into this space to our advisors and then also went on to ask them if we do this, what are the 4 or 5 critical things that you want from us in terms of making a tool that you'll truly pick up and use? So in the ensuing months from March to about the end of the summer, we went about doing what our advisors and our users clearly were demonstrating some interest in and some need for. So we, at the top of the list, made it HIPAA compliant. Doximity is a HIPAA secure network, and it's a non-anonymous identified network. So
Mhm.
you or I on Doximity kind of have our namesake, our profile, and our credentials associated with our presence there. Folks went on to ask for things like the ability to instantly look up information that may or may
Yep.
not necessarily require engaging AI. Ideally, having some element of human in the loop, like peer review, how can we trust the AI output is, I think, a through line that folks are only now coming around to, where it's like,
Very
okay,
much so. And
clearly there's power here, but
yeah,
for this to be medical grade, we need to be able to check through on citations, potentially get individual human beings with expertise to opine, et cetera. And then a lot of the features that are baked into Doximity GPT kind of came out of those conversations as well. So as we went about doing that over the course of the summer, we significantly accelerated our pursuit of this end of actually kind of re-engaging our users with this net new functionality by virtue of acquiring a company called Pathway.
yeah, yeah. I
And
want to hear more about that for sure. I mean, I think they were an early stage company. Tell us a little bit about how that decision was made and how that has changed the product. We'd love to hear definitely more about that.
oh yeah, man, so much has changed in such a short period of time. So we were originally taken with the Pathway crew because half of the founding team and half of the team that worked on the product were clinicians. So
Hmm.
they actually created their tool, and ultimately the path that they took to creating that tool was influenced directly by some of the issues that they were running into deploying technology in their own clinical practice. And what they found was one solid step in the direction of securing trust in terms of the output of some of these advanced tools and ideally mitigating, though no one can truly reduce it down to zero, but mitigating the risk of kind of some of the issues with this kind of technology, like hallucinations or confabulations. Part of that could be accomplished by virtue of marrying artificial intelligence with a very, very large semantic graph of medical knowledge. So they had actually spent the first several years of their existing as a company and a team building out that graph.
Mm.
Within that graph are basically all of the guidelines that you or I might reference in our clinical care, a very extensive peer-reviewed database of drug monographs, all sorts of kind of direct citations and snippets from other derivative work off of guidelines, et cetera, all kind of interconnected with one another, that when interfaced with an LLM or artificial intelligence permits the performance of that tool to be a good bit more reliable.
Yeah.
So when we were initially discussing, frankly, just doing our diligence on the Pathway team, we found them to be not only a very strong cultural fit, but the technological lift and accelerant that they gave Doximity GPT was quite significant as well. So we like to joke in this period of about 9 weeks, we did 9 months or 9 years worth of work, depending upon how it feels and whom you're
That's
asking.
the AI space. It's like moving so fast.
Yeah, no, we were able to acquire Pathway, integrate their entire tech stack, and effectively re-release, for what it's worth, Doximity GPT now with this clinical reference capability at the end of the summer. So,
And
yeah, it
And I
went
think
super
that, yeah,
smooth.
I mean, that's phenomenal. And that clinical referencing, I say you don't really trust but verify clinical AI. Ideally, you verify it and then trust it after.
Yeah,
Doximity GPT, Up-to-Date Expert AI, Open Evidence, Glass Health, there's all these companies now. They have also taken this approach of surfacing citations, obviously. I've used all these tools. Every single one is a little bit different in
yeah.
their philosophy of how they surface information to the clinician. Tell us a little bit about what differentiates Doximity GPT from Open Evidence, Up-to-Date Expert AI, these other tools, why you feel like the approach you all have taken is the best one for clinicians using artificial intelligence like this.
Man, so that's a great question. We could probably we could probably chat about just that
Yeah.
for hours. It almost requires a beer, like the so at the highest level, what I would say, what we feel differentiates, frankly, anything that Doximity brings to market, let alone kind of our approach to AI clinical decision support, is our process, right? We have a very broad network of clinicians that comprise the membership of Doximity, and we have the capability to engage those clinicians and directly ask them how it is that we might improve this product to be most useful in their clinical practice. And I would harp on the word improve. So our approach is not that medicine was solved last Tuesday, right? Anyone who presents any technology as having been the solution to everything that ails healthcare, there's a healthy amount of hubris there, we feel, and we kind of try and take a different approach. That from my seat, if you were to plot up to date on one end of the spectrum, and let's say open evidence or glass health on the other end of the spectrum, on the open evidence glass health end of the spectrum, it's kind of more of a pure technology play. Up to date, I grew up trained on up to date. I have a tremendous amount of respect for that company and what they've built over the years. They kind of inhabit the end of the spectrum that is more humans are creating consensus, and then we're putting AI on top of that corpus, if that makes any sense.
It does.
We
Yeah,
are
having seen their product, I think that's definitely sort of their approach. Yeah.
we're kind of right in the middle of those two ends. If we were to plot ourselves, we have technology that enables us to move at a speed that the up-to-date process probably could not. And then we also have this human layer, which is a very broad and extensive network of folks who have domain expertise that can participate in the evolution of our product and, frankly, the content that this product generates over time. That is unique and kind of more up to date, if you will, but just done or executed in a different order of operations. So I would say that element, the peer review layer, the instant answers feature that we have that incorporates our drug monographs. We actually, at the behest of our medical advisors, provide full text access to the
Yep.
corpus of journals that are cited in terms of responses that Doximity GPT might provide them. And this peer review. We made an announcement a couple of weeks ago,
Saw that.
well, actually, just about a week ago, um, about peer check, which is this initiative that we are working with many distinguished leaders in the healthcare space to effectively have human input and oversight to Gen AI involvement in clinical care. We think we're uniquely positioned to provide something like that, that kind of splits the difference, if you will, between some of the companies and their offerings that you mentioned.
That's fantastic. Yeah, I saw the announcement around Peer Check recently. How do people get involved if you're interested in joining the Doximity team on Peer Check, or is this a curated list? Tell us a little bit more about the months to come there, because obviously human in the loop is so important. Uh, Firm governance is so important. And this is, I think, something interesting that you all have done. You have sort of really been forthcoming and forward about trying to embed and improve this peer review process. So, yeah, tell us what is on the roadmap for peer check if someone wanted to get involved.
So if somebody wants to get involved, multiple paths. It's equal parts. There's a curated element to it that you mentioned or alluded to, where folks like myself or almost exclusively myself will be reaching out to folks throughout the Doximity platform for opportunities to engage. As part of the announcement, we posted to the Doximity blog. If you even just Google Doximity Peer Check, it's one of the top results that shows up where Dr. Eric Topol and Dr.
Yep.
Benjamin together announced that they're co-chairing this initiative. And throughout that explainer, there's several opportunities to kind of raise your hand and say you want to learn more. Then alternatively, I'm Amit at doximity.com. You can shoot me an email if you're listening to this and you are interested in potentially participating in this initiative as well. So our thoughts after looking through some of the data of the early use cases, particularly clinical decision support in Doximity GPT, what we saw was that by virtue of kind of showing, having the tool show its homework, if you will, like pulling through those citations and references, is that there were hundreds of thousands of primary authors of the referenced literature that were actually Doximity members. So we reached out to many of those folks and asked them, hey, if you were to be brought back kind of behind the curtain, if you will, and given a peek at the AI representation or synthesis of your work, could you help us make it error proof? Could you participate? Would you be interested in participating in kind of that human layer of verification? And we've had a tremendous amount of success actually engaging folks who are not only kind of honored or humbled that their work is kind of contributing to this net new thing, but are interested, frankly, in maintaining like human expertise as being a significant part of how we all move forward as a system. So that's kind of the machinery of it, if you will. And then with Doctors Topol and Benjamin at the mission level, we are also kind of leveraging domain experts from some of the top institutions around the country to also opine as to how we can make sure that this corpus is living and breathing. It's as up to date as anything can possibly be. And when there are areas that, let's say, a pure technology might say X, or God forbid, you ask the same question 100 times in a row and you get
Yeah.
some variation of an answer, we can actually solve for some of those problems by maintaining human expertise kind of right at the center of clinical decision making.
That's fantastic. I want to ask, so I think that one thing that I'm noticing is there is this sort of race to the super clinical AI app. I think there's some convergence that's happening. You've probably seen other companies are coming out with their own version of Dialer, maybe not even disguising the name and calling it Dialer. You all have a scribe. Bridge has got a scribe. Epic has a scribe. I want to hear about a little bit of the strategy for Doximity around integrating more deeply into the workflow, specifically EHR integration, what that's going to look like. And then I'd love to hear a little bit more about what the roadmap looks like for outcompeting all these other companies. What is the secret sauce? Obviously, it's going to be well vetted. It's going to be, a tool that's trained on a lot of material, but they're all trained on a lot of material. What's the integration strategy? What's on the roadmap that you think we should keep our eyes peeled for and is going to maybe break the mold of how the super app is emerging for clinicians?
Yeah, that's a great question. to your point about convergence, it's interesting. Yeah, the technology you could argue over time will, if it has not already
Getting
become,
commoditized,
yeah,
right?
kind of commoditized to a
Yeah.
certain degree. We take a lot of pride in what almost sounds like a misnomer, but even from the earliest days, we kind of presented our approach and then subsequently the products that were deliverables of that approach as quote unquote practical AI, right? So that sounds like an
Mhm.
oxymoron, but technology more broadly, we think becomes useful if it's actually presented in a way that it can be useful. So
100%. Yeah,
as
absolutely. There's
trite
a
as
lot of
that
useless
sounds,
AI out there. No, there's
yeah,
100%.
right.
Yeah.
And
Yeah.
like a lot of that in the healthcare space, as you know, um, it entails trust, it entails privacy and security, it entails being able to pass through all the hoops of a health system, signing off on your tool being
Hmm.
legitimized for use. It entails similar hoops to jump through to permit integrations into EHRs and other tools that folks use. For Doximity GPT specifically, we have deeply integrated it into other elements of the Doximity toolkit. Again, all in pursuit of not only maintaining trust and security and privacy and being clinicians first, but ideally being able to develop some utilization of the output of the tool in a way that's more productive. Um, the clinical reference example being one of them. Asking and answering questions is great, and the extent to which that you can continue to ask and answer those questions and provide answers that give people a good deal of confidence. I believe, as you said, there's already been convergence there in
For
terms of
sure.
tools, ours included, being able to kind of meet users where they are expressing a need. Being able then to take that output, though, and deploy it in the midst of a telemedicine visit, or fax it on to a pair, or share it with another colleague, or export it into an EHR where we have an integration. All of those things permit that output to actually now move the needle from a clinician's perspective in terms of saving them time.
Yeah, now you're
So,
talking about different modalities, right? You all have fax, you have outbound voice over internet protocol to make phone calls. Uh,
mhm.
is patient-facing AI coming in the Doximity stack? And I think there's two questions here. Hallie Tecco asked this of the Open Evidence CTO. Why not put a tool like this in patients' hands? Why not, let a patient have access to referenced, super intelligent AI? They're uploading their records to ChatGPT. What's the Doximity philosophy there? This is obviously a clinician tool, but would love to hear, what your thoughts are and what the company's philosophy is there.
Yeah, so I would say starting with the company philosophy, our philosophy has always been clinicians first insofar as that's where we focus. That's not Doximity saying or I saying that, honestly, man, you know this as well as I do. Even if we didn't want to put these tools in the hands of patients, they're going to be in the hands of patients.
100%.
And that
Yeah.
is
Yeah.
something that we all need to kind of confront together as
Yeah. And,
clinicians.
and I think like that's some of the argument is these patients are using tools that do hallucinate. You ask ChatGPT, the consumer facing version, something, and it's not vetted. Meanwhile, you've got a phenomenal tool. And I have my own perspective on why I don't think these tools should necessarily be in a patient's hands. But I do think that there's this argument to be made. Well, they're using these tools that are not vetted for clinical references. Wouldn't it be more safe to have this state of the art, peer checked clinical AI for patients? They can handle it. They're obviously uploading their records into ChatGPT and these other consumer facing tools. What's your thoughts there?
Yeah, so I mean, we used to joke like I trained effectively in the quote unquote like WebMD or Dr.
Dr.
Google
Google.
kind of generation, right? Where
Yeah,
folks would come in armed with a
they're
lot of
printed out questions, right?
information as
Yeah,
well as kind of decisions maybe that they made before even engaging with the healthcare system. And that could introduce conflict at times. That could often expedite how you would actually engage with your patient because they came in more knowledgeable than kind of just being scared. So I think it has the potential to be a double-edged sword. And
100%.
Doximity's answer is less focused on trying to not provide access to this technology to patients. It's just the way that we are structured as a company and as a shop that develops software solutions or technology solutions for clinicians. We are not inherently kind of patient focused.
Yeah,
The ideal would be for clinicians alongside their patients to
100%. Yeah.
engage with products like those that we've brought to market so that, frankly, both parties can leave that interaction feeling fully confident, fully trusting the output, and then empowered to do the next best thing to advance that person's care. We did make the decision to make DocsGPT or DoximityGPT.com public facing insofar as people could be exposed to the tool.
Mm.
That was primarily a decision that was made to make it easier to access for our clinician members. There is a cap, if you will, if you've done more than a couple
Right.
of
Rate
queries,
limit.
yeah,
Yeah.
you're prompted to then log in. Clearly, a patient could go to that
Yeah.
website and ask a question and then kind of present that information to their provider. Part of our approach with PeerCheck is ideally to remove some of the variability that both ends of that spectrum might get with the output to a given
Yeah.
query. And then, frankly, what we've done with other parts of our ecosystem is, as a service to our users, give them some insight as to what their patients are reading or what their patients are exposed to. And that's actually gone over quite well. So I would say our summary position is not so much that we are trying to make Doximity GPT or more broadly AI restricted from patients. It's just not our personal point of focus as a company,
Yeah.
specific point of focus as a company, at least not yet, to build patient-facing tools.
Yeah.
There's an
Yeah.
entire different world that exists when it comes to that. Might we go down that path? Doximity GPT, given its uptake, given the volume of usage, given how transformative we think this technology could be, could very well open doors for us strategically that historically we had not necessarily considered as strongly. I would argue as a company, we're not there just yet, but we hope that the more empowered that we make our clinician user base to leverage these sorts of tools to advance patient care, the patients are going to be right along with them for that ride. And
Yeah.
the actual benefit of any of this is improved patient outcomes. So, how we get to that endpoint, if it entails being more permissive in terms of patients being able to access similar content, I will admit that that's a decision we have not firmly made one way or the other as of yet. We're just focusing kind of on our core, which are the clinicians that are the Doximity members.
Yeah, yeah. I mean, I really appreciate that answer. It's really interesting that you're still expressing some openness and acknowledgement that this field is just moving so quickly, and where you can move the needle on outcomes can change on a dime. I really like your point, right? That ultimately we're trying to develop these tools and get them in the hands of clinicians because we want to improve patient outcomes. And you also mentioned, you're finding that Doximity is navigating into spaces that it wasn't necessarily expecting to find itself in because of this opportunity. One thing that I am really interested in is this idea of population health and deploying clinical tools that can integrate not just directly into the workflow for me to, draft a prior auth letter or to ask a clinical question, but to influence the care that gets delivered. I have this idea that, with tools like Doximity or Open Evidence, you could surface the right question at the right time in an asynchronous clinical care pathway. Tell me a little bit about whether or not Doximity is thinking about integrating its tool into some of these value-based care workflows. The access model just got announced. Everyone is scrambling. These digital health companies, I think, are realizing this is a whole new lane for engaging with patients, Medicare beneficiaries, and improving care. Is this something that you all are thinking about how to deploy this tool in the clinician's immediate workspace, but then also throughout the asynchronous care that gets delivered? Or is that, too far gone off of the beaten path of what Doximity is meant to do?
No, so I mean, again, I think that's a tremendous question. I don't think it's too far gone off of any given path, but I will caveat that statement by saying, just given the breadth of our network and the diversity of specialties on the platform, as well as practice environments, et cetera, it's very difficult to kind of view our approach in terms of bringing tools to market for our users as this is very clearly what we're doing over here, and this is very clearly what we're doing over there. Really, our point of focus is to make a most broadly applicable, useful, trustworthy tool that then clinicians, frankly, based on their practice environment, may very well leverage in these value-based care type scenarios. What you described, I've heard several folks in the space kind of describe as, hey, are we going to have effectively kind of like full self-driving for clinicians, right? Like,
Yeah,
are we
yeah,
going to have this back end with so much data that it can basically keep clinicians in their lane by kind of prompting them appropriately, et cetera.
Yeah.
And
And
I would
we do
be
that. We do that a little bit in some of these value-based care models, right? We like surface risk scorecards to patient or to clinicians, like you should think about doing X, Y, Z. But sorry, go ahead.
No, no, no.
Yeah.
And we are certainly not inhabiting a position where we're going to try and say that that's not in the options set. Developing to that end and declaring that that's our objective is also not the case for what it's worth.
Yeah.
So, like, my truthful answer to your question would be yes and no, if that makes any sense. Where we are today, I think it's particularly difficult to predict where the broader industry armed with now all of this technology will be in 2, 3, 4, 5 years. If we can make tools that clinicians both trust, they can use at the point of care with their patients in a trustworthy way, they can plug them into endpoints that permit them to advance their patient's care in a variety of different ways. I think that's a perfect foundation on top of which many of these other downstream use cases could certainly evolve. As you know as well as I do, if not better, you're a surgeon in the US healthcare system. All sorts of other things show up
Oh
that
yeah.
often will compromise the potential of a technology to effectively accomplish, let's just to use the same metaphor, actually get to full self-driving, right?
Yeah.
And that's up to as simple as things as there are silos between healthcare systems.
Yeah.
Simple things like that are hangups that I would say, at least today, are outside of the scope of Doximity as a company to directly put our finger on the scale. But the throw weight of our network and a lot of folks using our tools can certainly help influence how the broader system solves some of those problems
Oh,
downstream.
I love it. Yeah. And you all have been very collaborative, I think, as a company. And probably the reason you've been so successful is because you listen to user feedback so well and or tapped into such a rich network of user feedback. So yeah, I think that we're coming into the last few minutes. What should we be excited about on Doximity's roadmap? If we're having this conversation again in 2 years, what will Doximity GPT have enabled that isn't possible today for clinicians?
I think viewing artificial intelligence as a product unto itself permits a lot of folks to maybe wrap their mind around it in one way or another, potentially get caught up in hype around it, et cetera, and then kind of think about it as if it's this wholly separate element of what it is that we're trying to do. Doximity GPT from our seat is not only a tremendous product, we're very proud of it, particularly kind of post pathway acquisition. We've really up leveled what it can do for our clinicians. But we think the actual unlock of Doximity GPT is infusing its capabilities into the entire ecosystem that we've built for clinicians over the last 15 years and some change. So bringing AI to one of the most broadly used telemedicine platforms in the United States as an example. You mentioned several minutes ago, kind of leveraging or thinking about Doximity as kind of a news aggregator or a content machine.
Yeah,
We now have all sorts of tie-ins between our AI capabilities as well as kind of the news consuming experience on Doximity. And frankly, underneath it all, Doximity is a very large network. So leveraging AI in multiple ways to permit connections across the broader US healthcare system. Frankly, having users not only teach us what we should build next, but teach one another how best AI can actually be deployed in the practice of medicine and really bring this technology to life. We think that's a lot of what will not only differentiate Doximity's AI offerings from others in the space, but really bring value in a practical or pragmatic way to clinicians on the front lines. So it's equal parts continued leaning into users asking for specific features and building those features. We have our next medical advisory board in just a couple weeks here in the spring of 26. Beyond that, though, it's really up-leveling everything that we offer our clinician member base by virtue of taking this very powerful technology, making it accessible, making it feel secure and safe, keeping clinician autonomy, privacy, and security front of mind, and then just showing them how, in very practical ways, this can unlock significant benefits in clinical practice. Yeah, well, I mean, we find ourselves genuinely excited about what can happen. And frankly, even just the last several months of progress in regards to effectively transforming something that was fashioned initially as one thing into being that much more. We feel like we're just at the tip of the iceberg.
Tip of the iceberg for sure. Really appreciate this. I think we're all excited to see what Doximity comes up with in the clinical AI space in the next year, the next month. Really appreciate you coming on. This was Dr. Amit Phull, Chief Clinical Experience Officer at Doximity on the Techie Surgeon podcast. We were so excited to have you. Would love to have you back again. And yeah, thanks so much for joining.
Thank you, man. This was a wonderful conversation. And yeah, thank you for creating content like this, to be honest. As I said, I already showed my age some time ago, where it's like those kinds of opportunities didn't exist when I was in training. I'm like, as a fan of this sort of content, just excited to see folks like yourself synthesize all the happenings in the space from the perspective of clinicians and then being able to communicate it in the right context to folks who often, as you know, as well as I do, if not better than I do, don't have the time to stay up to date on everything and don't really know who's building what for what reasons and what is better or worse than the other. So yeah, thank you for having me on. It was an honor.
Absolutely. Yeah. And that's what we try to do here. And thanks, everyone. You've been listening to the Techie Surgeon podcast. Please tune in next time.